Once upon a time, in a country bustling with opportunity, a baby girl is born, a tiny princess to her adoring family. While she is treasured and protected by all who love her, her story won't unfold as the simple fairy tale they would like it to be. This is my story, and the story of women everywhere. It's the story of women taking control of their own destinies, women of courage, passion, persistence, innovation, compassion, and determination. It's about those who dare to break barriers. It's no easy task taking the road less traveled, but at the end of the day, the appreciation is worth it. Remember, the most interesting stories are not of those who had it easy. We rise, we fall. But what's important is that we find our inner strength and stand tall. Women, know your value. Wear your crown. Write your own story. We believe there's no limit to what you can accomplish. Happy Emirati Women's Day.
Look at the world today. What do you see? The largest youth population in history, most in developing countries. The spread of conflict and instability from isolated pockets to whole regions, and a swiftly growing population that must be fed. How do we address global challenges in a rapidly changing world? By empowering women and girls. Investing in women and girls accelerates progress in every area. When girls have access to education and technology, they can learn more and earn more, pulling themselves and their families out of poverty. When women have equal rights and opportunities as peace builders and leaders, peace agreements cover more ground and last longer. And when women have control of resources, land, and markets, they can play a vital role in helping to feed a hungry planet. From climate change to extreme poverty, women are proving they're ready to transform the world. We cannot solve the world's problems without women, period. The way forward is clear. To meet the challenges of the future, we need to empower women and girls now. It is one of the smartest investments we can make, and we can't afford to wait.
Bismillahirrahmanirrahim. Assalamualaikum warahmatullahi wabarakatuh dan salam sejahtera. Welcome to the next session of the International Women's Day event. And today's session, we will begin with the recital of Surah Al-Fatihah. May we invite Ustaz Haji Afiq to start. Ustaz Haji Ashraf from Japim to recite Surah Al-Fatihah.
Astaghfirullahalazim. Al-Fatihata ila harjul habibi sayyidina Muhammadin sallallahu alaihi wasallam wa sahbihi wa man walah, thumma ila arwahi jami'il awliya'i wa syuhada'i wa salihin wal a'immah ar-rasyidin, thumma ila arwahi walidina wa masyayikhina wa mu'allimina wa dhawil huquqi alaina ajma'in, thumma ila arwahi amwatil mu'minina wal mu'minat wal muslimina wal muslimat, anna Allah yaghfir lahum wa yughli darajatihim fil jannah wa yanfa'una bi asrarihim wa anwarihim wa ulumihim fid dini wad dunya wal akhirah. Al-Fatihah. Athakumullah. A'udzubillahi minasyaitonir rajim. Bismillahirrahmanirrahim. Alhamdulillahirabbil alamin. Arrahmanir rahim. Maliki yaumiddin. Iyyaka na'budu wa iyyaka nasta'in. اهدنا الصراط المستقيم صراط الذين أنعمت عليهم غير المغضوب عليهم ولا الضالين آمين.
Amin, amin, ya Rabbal Alamin. Once again, welcome to today's event of International Women's Day, organized by the Ministry of Culture, Youth and Sports and the Brunei Youth Council. And today's session will be conducted in both Malay and English. Jadi topik kita pada hari ini ialah mengenai wanita, apakan PCOS dan TTC ini. Or in English, about women, what is PCOS and TTC. Before we begin the forum session, we will start with the group photo. So may we invite everyone to please switch on your cameras. Okay, we'll give everyone a second to set up their cameras. Okay, everyone ready? So on the count of 1, 2, 3. Okay, one more. We have about 10 pages, so give me a second. So on the count of 1, 2, 3. Next page. 1, 2, 3. 1, 2, 3. All right. So thank you very much, everyone. So without further ado, I would like to introduce to you our moderator for this event. So today's session will be moderated by Nurul Izzian Anwar, who is the Timbalan Yang di-Pertua Majlis Belia Brunei. And we are very excited to welcome our panelists, Dr. Sarina Haji Hashim, Penolong Profesor Kejuruteraan dan Perbidanan, Universiti Brunei Darussalam, Dr. Hajah Solaiha Islam, Gynecologist, Klinik Prema, Angie Ang, Ahli Teras Young Professionals Network Brunei, and Ahli BBNS Youth Advisory Group, Rina Habib, pekerja grafik Jurdong International School, dan pemilik Ina Lavender Co. Without further ado, I would like to pass the floor to Izzian.
Bismillahirrahmanirrahim. Alhamdulillahirabbil alamin wassalatu wassalamu ala asyrafil anbiya'i wal mursalin sayyidina Muhammadin wa ala alihi washabbihi ajma'in. Yang berhormat Dayang Khairunisa binti Haji Asyari di Majlis Mesyuarat Negara selaku Yang di-Pertua Majlis Belia Brunei, Yang Mulia Pegawai-Pegawai Kanan Kerajaan, Yang Mulia ahli-ahli panel yang dihormati, beliawan dan beliawanis dan hadirin hadirat yang dihormati sekalian. Assalamualaikum warahmatullahi wabarakatuh. Salam sejahtera dan selamat petang kepada semua. Selamat datang ke Forum Sempena Sambutan Hari Wanita Antarabangsa 2022 yang bertema Kesaksamaan Jantina Hari ini untuk masa depan yang mampan. Forum kita pada hari ini yang bertajuk mengenai wanita, apakan PCOS dan TTC ini. Izinkan saya untuk memperkenalkan diri, Nurul Izzian Anwar, Timbalan Yang di-Pertua Majlis Belia Brunei selaku moderator bagi forum kita pada petang ini. Sebelum kita memulakan sesi forum kita pada petang ini, izinkan saya untuk bertutur dalam bahasa biasa dan Inggeris ya. Kita teruskan lagi dengan sesi forum ini dengan memperkenalkan ahli-ahli panel kita yang terdiri daripada wanita-wanita yang hebat. Firstly, I would like to introduce our first panel speaker. Graduated in Bachelor Degree in Medicine, Bachelor Degree in Surgery MBBS in 1977 from Dhaka University. Went to Monash University, Melbourne, Australia for her post-graduation studies and received her training from Monash Medical Center. She served in obstetrics and gynecology in various countries, including Melbourne and Libya. She started working in Brunei in 1996 in obstetrics and gynecology under Ripas Hospital and currently working in Dr. Prema Clinic from 2020 as obstetrics and gynecology specialist. We welcome you, our first panel speaker, Yang Mulia Dr. Hajar Sohaila Islam, gynecologist, obstetrician from Dr. Prema Clinic. Secondly, I would like to introduce you Dr. Sarina from University of Brunei Darussalam. She is an assistant professor in nursing and midwifery at Penyiaran Anak Puteri Rashidah Saadatul Bokia Institute of Health Sciences, University Brunei Darussalam. Her research interest focuses on exploring pregnant women healthcare seeking behavior when they were diagnosed with pregnant-related complications, and this includes hypertensive disorders of pregnancy. Her other research interests include nursing and midwifery, education and practice, women's health and pregnancy in childbirth. We welcome you, our second panel speaker, which is Dr. Sarina. Okay, third and fourth speaker would be Angie Ang and also Rina Habib. Both are patients of PCOS. So Angie Ang is a training associate at Pinnacle by Golden Equator. She is the core team at Young Professionals Network Brunei, APAC leader at Obama Foundation, and also a leader at Southeast Asian Women. And also, I would like to inform you guys that she is one of the member of Youth Advisory Group for Dasar Belia Negara dan Strategy. Angie, where are you? Okay, sorry. Okay, next up is Rina Habib. So a little bit detail of Rina Habib will be, she is actually a graphic designer from Jerdong International School since 2017. She is currently running her own business that sells all natural chemical-free products for men and women reproductive health and wellness. Majority of customers are women with PCOS and couples who are trying to conceive. So we welcome you, our wonderful panel speakers. So before we start, I would like to ask, how are you guys today? So can I ask Dr. Hajar Sohaila to start? Basically, thank you for coming in for this forum. You can, switch on your mic. We can have a brief, basically energizer first before we start the forum. How are you guys today?
Alhamdulillah.
Dr. Hajar Sohaila, you're muted still.
So now can you hear me?
Yes.
Yes, thank you. So Assalamu alaikum all of you, and also very good afternoon and Bismillahir Rahmanir Rahim. So shall we begin?
Sure, I will start the question, yeah? Okay.
Right.
Okay, thank you, Dr. Hajar Sohaila. So basically, our discussion today is basically we wanted to know what is PCOS in general, and also what is trying to conceive. So in terms of medical, how we as public should, conduct ourselves regarding PCOS, and basically what are the symptoms that, women are facing with PCOS. Basically, we just want to understand what is the relation of PCOS with trying to conceive.
Yes, thank you for the question. First, let me start by defining this situation. We are saying PCOS. It means polycystic ovarian syndrome. And the word syndrome should imply to all of us that it is a combination of many symptoms and disturbances in the body. So if we want to define it in a medical way, we can say that polycystic ovary syndrome or ovarian syndrome, it is, first of all, let me tell you, it is one of the most common endocrine and metabolic disorders in women nowadays. I mean, it is diagnosed more than before. And it is heterogeneous by nature, by which I mean that it is defined by a combination of signs and symptoms, and they are basically based on three problems, which is androgen excess. Means, first of all, let me say simply for everybody to understand, there is an imbalance of the hormone in the woman's body. And the hormone which is mostly primarily, gets the excess situation is androgen, which is the hormone which is a little bit more in the male, but in women, this hormone is not playing the main role, the other hormones. And there is ovarian dysfunction, and there is also, this is a complex multigenic disorder. And as so much research has been done, people will ask that whether this is genetic in nature or not, because so many people are being diagnosed with it. But the research says that it is epigenetic. Epigenetic means there is a genetic factor, but it is not carried in the DNA of the person. It is in such a way in the, it is, transmitted in a genetic way that it affects the cells and multiple organs and also the environment we live in. So this is how our polycystic ovarian syndrome or polycystic ovarian disease, we will define it. And then I will also try to say that in this PCOS disease, it is associated with abdominal adiposity, insulin resistance, and obesity, and some metabolic disturbances. And when we attain age, which is past the reproductive age, you can have other complications which will involve the cardiovascular system as well as the target organs like the uterus. So this is how we can say. And I would like to add that the diagnosis and treatment of PCOS are not complicated. It requires a judicious application of few well-standardized diagnostic methods and treatment, because the treatment also is not like wide range of treatment. It has, medical personnel have very little choice of the drugs to be used. However, they are still the drugs which everybody prefer to use until today. So therefore, we have three situations as a medical person to consider: hyperandrogenic situation, an ovary which has become dysfunctional, and the doctors will also be able to find out the ovaries have changed their physical shape and size by ultrasound. By that I mean the ovaries have little small cysts which contain fluids which we call follicles. It happens to be much more in polycystic ovary. That is the name polycystic is given. So the cysts are more in number, more than 10 to 12. The whole volume becomes also of the ovary becomes more, and the gynecologist can do this by ultrasound. So by saying all these things, I hope somebody can explain to our audience a little bit in Malay. I hope I will be able to assist you along the way as well. And the other second part of the question is trying to conceive TTC, which means if you have ovarian dysfunction, the ovary is not functioning, it is not producing any eggs to, which is associated with the fertility of the woman. The woman does not produce any eggs, and therefore the woman cannot successfully get pregnant. However, before a woman seeks to conceive, if she is aware of her symptoms of menstrual irregularity, especially maybe less menses, which we call oligomenorrhea, or the menstrual cycle has lost its pattern. It is cyclical. It has to come with the cyclical influence of the hormones, but it has lost its pattern, and she has irregular bleedings throughout the year. Sometimes there is totally no bleeding for 3 to 4 months. So all these, complications, all these complaints can the patient can then seek the doctor's help. And the doctor, of course, will judge her in a clinical situation. The other signs and symptoms which can happen is excess growth of hair on the body, especially on the lips, on the chins, and the hair distribution of the body is in excess, which we name hirsutism. And then it is also associated with thinning of the hair on the scalp. And this is a little bit of, situation which goes according to the, usual distribution. And then there is the most important thing is that we see most of the people with PCOS having a high BMI. And it is the adiposity, which means the fat distribution is mostly central. And this is one of the features. The other features is that the patient may have some skin conditions, which is called patchiness of the skin, thickness of the skin, also sometimes due to hyperandrogenism, which means excess of the male hormone, which features in PCOS. She can have some voice, male-like voice. However, the doctors do diagnose not only by clinical assessment of the patient and her complaints, but also by some tests, which are quite simple nowadays to do. And that is how we will approach PCOS. And women who are, some patients seek help with the medical personnel, and they become aware of the situation when they are married and they try to conceive. And then the story also comes out that she has not been having menses regularly, but sometimes she has, downplayed this feeling, or sometimes she did go to the doctor and it was temporarily sort of treated, which we call, she was given medicine to have withdrawal bleeding. So, however, the whole PCOS, the whole spectrum of the disease can, of course, be taken seriously and diagnosed by the doctor, so that the effect is and the benefit comes a long way. And when the woman who is trying to conceive, basically, I feel we have to correct the basic features, the problems of PCOS, hyperandrogenism, insulin resistance, then ovarian dysfunction, that is simple terms, correcting the menstrual cycle and see that the ovaries are functioning properly. And also there is some insulin resistance in the body, which we also have some medications to give, which is also recommended by the Royal College of Guidelines. They are, insulin sensitizing agents. And when she corrects her basic features of hyperandrogenism, insulin resistance, the ovary starts functioning in a better way. We can expect the ovary to ovulate. Maybe not so frequently as a woman without PCOS, but quite frequently, and helping, and a little bit of help along on the medical line can help her to, actually she can hope to have ovulation regularly, or maybe more frequent than before, and then she can successfully get pregnant. In the literature, it has never been said that a woman with PCOS can never get pregnant. She can get pregnant. But in our practice, we see when we correct the basic features of hyperandrogenism, obesity, or correction of the BMI, as we say, and ovarian function is also looked into, then we really, if the woman is going towards trying to conceive, we can help. However, we also have to consider at what age the woman seeks help. There is a fall of ovulation frequency from age 32 onwards, and from age 37 below, there is a drastic fall. So this PCOS symptom, if a girl or a woman or any girl of the house is aware earlier, because it will start not immediately after puberty, because we take 2 years for the girl's puberty to really set in. There is also imbalance of the hormones for the first 2 years, so she sets in. But in her adolescence period, if she starts after having normal menses, if she starts having these symptoms continuing into the reproductive phase, then those are the important times when she can seek help, medical help. And when she gets married, her chances of getting pregnancy is better if she wishes to have that. And of course, I will finally later discuss that because it's a lifetime situation, you have to take into consideration your lifestyle, your health issues until you are even menopause. If you have once been told by a doctor that you have a PCOS situation. And I will also discuss later would like to discuss later about some lifestyle changes. And I know our other panel speakers also have good, guidelines and counseling methods, which they will also discuss.
Thank you for the wonderful and very insightful information, Dr. Hajra Sohaila. And then I would like to ask this question to Puan Dr. Sarina. So bagi pendapat Dr. Sarina, pandangan tentang PCOS ni in terms of public understanding and also in basically women, how what's the level of understanding about PCOS ni sebenarnya dalam pandangan doktor?
Okay. Bismillahirrahmanirrahim. Assalamualaikum warahmatullahi taala wabarakatuh. Terima kasih atas soalannya Izan. Terlebih dahulu, saya berbesar hatilah di atas undangan, selaku salah seorang panel bagi forum kita pada hari ini, iaitu mengenai isu polycystic ovarian syndrome and trying to conceive, sempena Sambutan Hari Wanita Antarabangsa pada tahun ini. Now, soalan yang Izan tujukan itu, apakah yang saya ulangi lagi sekali lah, pandangan tentang PCOS dan apakah kepahaman orang awam dan juga wanita mengenai dengan tentang PCOS ini. Alright. Now, dari bahagian pandangan dari kejururawatan dan perbidanan so saya akan mengulas lagi apa yang barangkali Dr. Sohaila tadi sampaikan in Malay menolong untuk memahamkan lagi pendapat orang ramai mengenai dengan PCOS ini. Now, dari apa yang telah disampaikan oleh Dr. Sohaila tadi, PCOS ini bukannya tergolong dari kategori penyakit, melainkan lebih dari kepada kumpulan gejala, daripada beberapa hal. Dan buat pada masa ini, belum ada penelitian tentang punca sebenar yang menyebabkan PCOS. Walau bagaimanapun, ada teori yang berpendapat yang Dr. Sohaila mention, genetik. Mungkin salah satu daripada penyebabnya. Misalnya jika ada ahli keluarga seperti ibu atau saudara perempuan yang mempunyai masalah ini, kebarangkalian untuk wanita tersebut boleh menghidapnya juga tinggi. Jadi disebabkan oleh kesukaran bagi mengenal pasti punca sebenar PCOS, so tidak heranlah kebanyakan wanita termasuk juga orang awam menganggap diri mereka kurang pengetahuan mengenai PCOS ini. So yang mana kurang pengetahuan ini mengenai PCOS ini dianggap boleh memberi impak yang negatif terhadap kualiti kehidupan seseorang. So kurangnya kepahaman mengenai PCOS boleh membuatkan wanita yang mengalami berasa kecewa. Dan boleh juga menyebabkan timbulnya masalah kemurungan, kebimbangan dan ditambah lagi dengan perubahan bentuk badan iaitu kegemukan bagi sesetengah wanita hingga semua. Dan menyebabkan mereka berasa kurang keyakinan diri. Dari satu kaji selidik yang dibuat di luar negara mengenai dengan health seeking behavior and support bagi wanita yang menghadapi PCOS ini menunjukkan bahawa 30% wanita bergantung kepada forum yang tadi buat masa ni lah tu bagi mengetahui apa maksud PCOS ni ya. And ada juga yang bergantung kepada talian untuk mendapatkan sokongan. Okey, 20% juga mempercayai Instagram yang berpengaruh dan 18% mempercayai maklumat yang mereka dapati dalam kumpulan Facebook mengenai perkaraan ni ya. So dari sini Tani tahu, Tani dapat melihat mereka ataupun wanita dan orang awam, diorang lebih condong mendapatkan maklumat mengenai PCOS dari internet, daripada mendapatkan nasihat dari para profesional kesihatan. So it is very concerning that tidak ramai di kalangan wanita, termasuk juga orang awam, memperolehi kepahaman mereka dari maklumat yang mungkin diragui kesahihannya. So sebahagian besar orang awam juga berpendapatlah in terms of pandangan durang lah ni terhadap PCOS ni. Durang berpendapat yang jika seseorang wanita itu mengalami PCOS, so peluang untuk mendapatkan zuriat ataupun anak agak tipis, okey, ataupun sukar untuk mengandung, dan sesetengah orang menganggap wanita tersebut mandul so tidak dapat beranak langsung, okey, atau kurang kesuburan, okey. So ini yang perception pandangan orang awam, and then also mengenai dengan PCOS ni. Jadi kajian berkaitan, ada kajian berkaitan dengan PCOS juga mendapati bahawa bagi wanita yang menganggap mereka memerlukan nasihat atau sokongan, kebanyakannya diorang ni indah mau berjumpa dengan profesional perubatan, diorang lebih suka untuk mencari information itu melalui internet untuk mendapatkan diagnosis. Macam diorang explore lah, benar ke indah kau ni PCOS ke ataupun ada masalah lain. Okay, so dari sini kita boleh melihat ada beberapa faktor yang menyebabkan wanita tidak mahu berkongsi masalah ni seperti disebabkan oleh perasaan malu, untuk berkongsi masalah pribadi ataupun takut untuk mendapat stigma sebagai perempuan yang tidak dapat beranak. Okay, so bagaimanapun ada juga wanita yang mempunyai sindrom PCOS ni berupaya hamil secara semula jadi. Jadinya dimaksudkan di sini hingga semestinya PCOS ni orang itu tidak dapat beranak langsung. Okay, jadi ada yang actually dapat mengandung secara semula jadi tanpa bantuan rawatan kesuburan. Okey. So barangkali ini nanti ada Dr. Sahila akan mengongsikan lagi apakah rawatan yang terdapat di luar sana untuk menolong wanita ini untuk menambah kesuburan mereka. Oleh itu amatlah penting bagi profesional kesihatan memberi kepahaman ini dan menyebarkan maklumat untuk membantu meningkatkan kepekaan atau awareness mengenai PCOS di kalangan wanita khasnya dan juga masyarakat Aminah.
Okey, terima kasih Puan Dr. Sarina Hashim on kita punya itulah ucapan. So seterusnya kita menginvite NG Ang untuk men-share experience-nya sebagai one of the PCOS patients. I understand that you've been experiencing PCOS before this. I am assuming now that you are recovered. So can you please share a brief history about your journey with PCOS and what has changed, what hasn't changed in your opinion?
Hi, Izan. Thank you. So I don't know if recovered is really the right term because I think it's not something that just recovers overnight. So I've been officially diagnosed with PCOS around in 2012. So that's like almost 10 years ago now. And honestly speaking, I think I had it for much longer kan, tapi like there wasn't like any proper diagnosis. I was in the dark for quite a while. I think I first suspected it in like 2008 or 2009, but during that time there wasn't like any I guess any real what you call that, real proof about how it was, because I was really young then, so I'm really bad at math, so I don't remember how old I was then. But this was like, okay, so 10 years ago I was 20, so a couple of years before that, so I was around like 17, 16, 17, and I had like, a few issues, and I think at that very young age, you don't also think about like you need to go and see a gynae. So like, and it was something that it didn't cross like my mind or my mom's mind that you need to go and check to see like if something is wrong, or they just take it because it started off with like abdomen pain, this and that, and irregular periods, and you just think that, oh, because you're a teenager, you're going through puberty, it's a normal thing, you don't think too much about it, and instead I got misdiagnosed with irritable bowel syndrome instead, that I have IBS. That's why I was like constantly having like tummy ache, or I wasn't having appetite and this and that, and so we actually went to the doctors here in Brunei, in Singapore, and then much later I was in the UK. I was studying, and even when I was there, I went to the doctors because it was really bad. My periods were really irregular, and there are times when either I don't get my period for like 3 to 4 months straight, or I get my period like twice in a month, and sometimes it's heavy, sometimes it's not, and there was a lot of things that was going on, and like, and especially when you're away from Brunei, I guess when you're alone, you're sort of like, you're scared, you do not know what's going on, kind of like you're surrounding the UK, entah what's going on, and then you're like studying, and so I came back during the summer of 2012 for my brother's wedding. So I came back to Brunei and Singapore, and I realized that I gained a lot of weight. Like I put on a lot of weight, and obviously that's the thing when you're in UK and you balik, and then everyone's be like, "Eh, makin sehat ah," everyone's just like, like how like, and then it was really hard because you're at the age where you're quite young and you want to look good, and I'm coming back again, like I said, for my brother's wedding, right? So you want to look good, you want to like wear nice dresses and this and that, and at that point I was close to like I did have my period for like almost like 6 to 9 months. It was really bad. So and I was talking to my mom about it, obviously, and she was like, I think maybe it's you should go see a gynae. So and it was very awkward, I'm gonna say. I think it was really funny. Thinking back now, it sounds funny, but then it was actually really scary going to the gynae, because you have this conception that preconception that you go to a gynae if you wanna, like, if you're pregnant or you want to try and get pregnant, right? And then you have me where I wasn't married. I mean, and I was like, I'm not going to the gynae. And I was just sitting there, in the room, in the hospital, and people be looking at me like, and you can see all the judgment, and they'd be like, is she like a pregnant teen, or, like, did she do something wrong? And I'm just like, no, I just want to see the doctor. And it was really bad. And then I remember I met the gynae then, and this was actually at Repas, yeah. So I actually finally got my diagnosis here in Brunei at Repas. It was a really young doctor, and she was really nice and really calm about it. So I met her and I told her everything that's been happening since 2008, 2009. And I told her like all the different treatments that I've been given. I was given like obviously hormone pills because I was gaining weight and stuff. I was even given appetite suppressant pill because my mom just thought that I was gaining a lot of weight. So we went to the doctor and they were like, maybe she just have a crazy appetite, and they were like giving me a lot of things. So I finally met this guy, and so I told her what's been happening, and then she was like, then she told me, she was like, so this is sort of like fairly new then, in 2012, she was like, not a lot of people has been diagnosed with it yet, but it might be it. And it's something that people are still researching into, and it's starting to be very common. And she said that it's PCOS, polycystic ovary. And of course, she asked me if I know if I have any family history or anything. And my family do have history of cysts, and like in the reproductive area, but I don't think anyone had polycystic ovaries. And the other thing about my family is that we also have a history of early onset menopause. So, I was really worried at a 20-year-old. At 20, coming 21, I obviously want to have kids one day. and I know both, Dr. Zaila and Dr. Sarina are saying that, there's this misconception that people say, kalau you are the PCOS, after chances are you can't get pregnant. And I know that over the years, there has been, research proven and shown that no, you can have PCOS and you still can get pregnant. But, added on the stress of my family's early onset of menopause, I was at a point thinking like, oh my goodness, my eggs don't work. I get menopause. I'm doomed. That's it. That was the point at 21, and I was like, you know what? I'm just gonna adopt a child. Perfectly fine. Everything's gonna be okay. And but honestly speaking, when I received that diagnosis, then before I felt like scared and everything else, it was actually a sense of relief, because I then finally know what I was dealing with, and I could finally get the right medication. But don't forget, this was like 10 years ago, kan. So masa tu you thought that was the right medication compared to now. And I've said in the past 10 years, my medication has changed a lot. And there was a lot of things. Again, it started off, I felt scared, right? Being in the gynecologist clinic, surrounded by pregnant women, and then you have this girl there, they'd be like, what have you done? That's one judgment. Then the second judgment came from, because part of the treatment was obviously to balance my hormones and my insulin level and this and that. So I was given metformin, which is something they give to diabetic patients. And I was so worried because my grandma had diabetes, and I was like, oh my goodness, am I gonna have diabetes too? And I have to take additional medication. And then I was given contraceptive pills, and it was really awkward because I was like, I knew why I needed the pills. It was for hormones. But obviously, people have that stigma, like, why are you on contraceptive pills? What are you up to? Why are you the guy? And it was really bad because I was like, I had to take them at regular times. But at the same time, I wanted to hide them. I didn't want anyone to know that I was on contraceptive pills, because I don't want people to be thinking that, I am doing unfavorable things. So there was that stigma for a little bit, but it did work. I felt that it worked because my period started getting regular. I started losing those additional weights, and all the other side effects. My skin got better. I was much more happier again, being myself. And but then again, because this was in very early stages, right? And my doctor didn't want to overwhelm me with too many things as well, because I was going back to the UK. So she gave me 6 months worth of medication and everything. And I took it for 6 months, and she told me to rest for a bit. And if anything, she gave me a prescription, which I can then, when I was in the UK, I can then go to the hospital and be like, here, I have additional prescription to get additional if I need it. So for 6 months, it was all great, to medication, everything. And then obviously I had to change my lifestyle a bit. I had to cut off I had to cut down on my sugar, especially. I had to cut down my sugar. I cut down my dairy, and I had to exercise a lot more than usual, because that was the other factor that they kept saying, that my doctors kept saying, you just gotta do your best to lose the weight, and then all the other weights will start losing as well, and then your body would right itself, right? And it was really hard. I have to admit that was the hardest part, and that was the one thing that I always didn't want to look forward to. I don't mind going to get the medicines. I don't mind going to do the blood test and everything. But the one thing that I really didn't want to listen was, you need to lose 10 more kilos. That was it. It's like at one point I got really in fact it was quite recent. So I say for the past 10 years I've been seeing different gynecologists. I've been having different type of medications, right? On and off, on contraceptive pills as well as other hormones, balancing and sugar balancing medication. I've never been on them for like a long period of time. It's always between like 3 to 6 months max, and then I stop for a while, and then I continue again because my gynecologist is telling me that your body needs to right itself, and you can't like be dependent on it all the time. So I was like, okay, that's fine, but that was the one thing. And my most recent visit, like pre-COVID in 2020, before the lockdown and everything, I remember going to my gynecologist. And when she saw me and she go like, and you just need to lose 10 kilo. I did that. I flipped inside the gynae room. And I tell you, it really is an emotional journey, and it really affected my mental health. And I think that was the point where I really, I lost it. After 10 years of being on medication, this in and out, I lost it. I was in her office. In her clinic. The nurse was there. My mom was there. And I just broke down. I just cried. And I told her, I was like, no, enough. Every time I come in, you give me something new to try. Every time I come in, you tell me I just need to lose 10 kilos. Do you think it's so easy? Why don't you try it yourself? And I was like, I could come in with I used to joke about it, but then that day I think I was really serious. I was like, I could come in with a gunshot wound, and all you would tell me is like, lose 10 kilo, and then what, my gunshot wound can magically heal itself. I was really, really pissed, and I was like, I don't want to hear this anymore. I was like, because I felt that like, if this is not something that you're going through, you don't understand, don't talk to me. It doesn't matter that you are the gynecologist. You do not know what I'm going through. And it's been 10 years, and I'm really tired. I'm really tired of my fluctuating weight. I'm really tired of not being able to, eat certain things. I'm very tired of being on this medication and then tell me stop, go try this other medication, no stop, and then come back to this medication. I'm really, really, really tired. I just want to, and I've been doing my best, I've been exercising and stuff, but my weight just doesn't want to go down, and I've reached a point of where I've come to accept my body and I am okay with it. And yet I go in there and she tells me, no, you just need to lose 10 kilos. And I was like, yeah. And the thing was, as much as people think that, it is now almost kind of common to talk about like people have PCOS, and I am great that I'm like glad that, people are more open about this topic now, that women and even men are, openly talking about, period issues and, the situations that people are going through, be it PCOS or even, trying to conceive, and it's no longer as much a taboo, a topic. But I do think that the other aspect of, where your mental health being is the one area that people tend to overlook. And that's why, this type of conversation has to still keep going. And yes, you can juggle your diet, you can, exercise, rajin go and exercise, and, makan all your ubat and everything. But I would say that you need to be very mindful of your body and listen to your body, like, and there are days that you don't want to do it. There are days when I'm just like, I don't want to get out of bed. I don't want to think about it, and that's perfectly okay. There are days when I'm just like, I'm not going to juggle my sugar today or anything. I just want to enjoy it. And, I'll just go and allow myself, because, just because I have PCOS or just because I'm on all this medication, it doesn't mean I cannot enjoy life. And I think that's a very important thing that a lot of, I think, be it young girls or even anyone in this situation should remember. And as cliche as it may sound, right, you really are not alone. There are actually a lot of us with this, and I've heard of success stories as well. I have friends who had PCOS, and they went through their treatment and all, and they are now like a mother of 3. And you know, and it's women like this that gives me hope that, you know, that things can get better. I will still continue to try and lose that 10 kilo. but yeah, but other than that, no. You know, I think this journey, I like, you know, Izzy, coming back again, I don't think I would say that I've recovered. I think this is a journey that I know I have to go on, and it's something that I'm not afraid to talk about anymore. Like, I'm not ashamed to be in a gynecologist clinic now. I'm okay with people asking me why am I having contraceptive pills, you know, and yeah.
Thank you so much, Angie. That was really, how do you say, I think for me, it is a wonderful story and somewhat relatable to me as well. So up next, we invite Puan Rina Habib untuk sharing her stories juga.
Okay. So Assalamualaikum everyone. Hi. Thank you again for inviting me to share my input for such a sensitive topic, but it's a topic that I really feel should be explored more, especially in Brunei Laha. So my journey started when I was 14. I had my period when I was 10, but it suddenly stopped when I was 14. And until I was 24, langsung, I didn't have any mens at all. If I was lucky, I would have it once a year. But so just imagine 10 years of just no menstruation. Back then, it wasn't a problem to me because I felt I was still young. It wasn't a big deal back then. I just wanted to like do my thing. I just wanted to do my studies. So my health wasn't really an issue then until now. It's taking a toll on my trying to conceive journey now. So at the age of 24 was when I first went to a clinic to get checked up just to see what's going on. And then from there, the doctor didn't really know how to diagnose me or didn't really know what information to give me to help me atola like figure out what is actually going on with my body. So dorang bagi birth control pills for like a span of maybe 6 months. And then lepas ato, they said the birth control pill is supposed to help induce my menstruation. So okay lah. So I just did it 6 months, and then adalah datang. Tapi after 6 months, they told me to stop and see if it would come back naturally, but then nothing. So it didn't really fix the problem that I thought was what I went to the doctor for in the first place. So I told them the pill didn't seem to work. I also experienced quite a lot of side effects like bloating. I had a lot of migraines. I had weird cravings. Sometimes I felt nauseous, but then they said it was all part of the side effects of the birth control pill, so I just let it happen. And then I just kept going on and on in different, so 24, I was 24 for my first clinic until now, I'm 30 now. I'll be turning 30 now. So to summarize it, in the 6 years that I've been getting investigated for my condition, I went to 6 different clinics just to try and get information that I can use to help with my condition, to help improve my condition. In the 6 clinics that I went to, semua ceritanya sama. It's the same. They just tell me, oh, here, we'll give you some birth control pills. Hopefully your menstruation will come back. So I'll just do it. So I do it. And then tapi it's the same thing. Like they give me the same information. They tell me the same results. Like my arm is so swollen from kana chuchok everywhere. They keep taking blood samples. They make me pee in a cup. They conduct so many tests on me. Tapi the results are still the same. It's not the results that personally I felt helped me understand why my body was the way it was, why I can't do this. So it was a long journey and it was very, very tiring. As Angie said, it is very tiring. It's physically tiring and it's mentally tiring. So you just want not really simple answers. You just want answers to help you understand why my body is the way it is now. And to link that with my now trying to conceive journey. I only recently got married in June 2020, so my journey only started then. Because I didn't really get the type of assistance back then when I was younger in preparation for my now trying to conceive journey. It's now just an even bigger journey to try and accomplish. So it's taking an even bigger toll on my mentality. So I went to a few clinics already to get checked. It's the same thing. They give me pills this, they give me supplement that, but it still didn't help with my PCOS with my condition. Right now, I was officially diagnosed though at JPMC maybe in February 2020. So that was when they officially gave me a document that said, yes, you have PCOS. I have 2 big cysts on my ovaries. Satu on my left, about 3 cm. Satu on my right, about 4 cm. So they said because of the cyst, it affects my hormones. So like Angie, the doctors tell me, mesti ito, jaga makan, mesti kurangkan berat badan, mesti exercise every day. You have to keep my energy level up. Mesti kurangkan stress. At payah kurangkan stress also affects women's punya hormones. It fluctuates it a lot. So stress pun mesti control. But then they gave me the one clinic I went to, they gave me a deadline to lose my weight. They said, I'll give you 1 month to lose 10 kgs. I don't think that's gonna happen. I tried. I really did try. They said just exercise 30 minutes every day. So I did. Be nothing. If anything, it just stressed my body even more. So I actually gained weight. So it's like Shamatullah is very different. It's very difficult to try and figure out. So it took too much of a mental toll on my mentality. So I took a break for 1 year and I joined a fitness program for a few months. And alhamdulillah, it actually helped me. My coaches taught me how to eat better, what exercises to do, how to control your stress, how to do certain movements right to optimize your workouts so you lose as much weight as you can in that short span of time. So alhamdulillah, that actually helped me with my PCOS condition. I actually get from last time getting no mens at all, I actually get mine now. Of course, still very, very irregular. I get mine every 3 to 4 months. But it's a lot better than what it was before. So at least now I know that I'm going down the right track, that our food and our health really does affect our body. So that was the one thing that I learned down the road. So yeah, but the PCOS diagnosis, I registered for JPMC is it PCOS screening package? I don't know if they offer it now, but that was really one of the pinnacle moments where I was like, yes, okay, I need to do that. So I just signed up and then they took my blood sample, they checked my insulin. There's 4 types of PCOS. I think that's what they told me. And my type is insulin resistant. So it's about my sugar, which is, I think, what Angie already touched base with a little bit tadi. So it was a lot to do with my sugar. Sikit-sikit makan sugar, our sugar levels will spike up. And then apparently it causes you to get sugar rush. And then if your sugar level is spiked up tinggi, you get more cravings for sugar. So I think that was where my area is, because I have a sweet tooth. I like anything sweet. So it's a bit challenging for me to control my sugar. But like with the fitness program I mentioned earlier, my coach taught me that you can find sugars, you can find sweetness in natural foods, you can find it in fruits, especially fruits. So it really does come down to what you consume and what you do, because inside your body, that's your vehicle to maneuver around the world. That's your vehicle. So you have to jaga your body as best as you can, and so yeah, that's pretty much my journey.
Thank you so much, Puan Rina. That is really, how do you say, a very, macam speechless lah ko bolehnya mendengar. Because how do you say, you are very strong to be able to mengalami this itulah perjalanan ni. I mean, I understand that, I myself, let me share sorry. I myself, when I was I think 12 kali. Yeah, when I was 12, I had my period. Kali sudah when I turned 13, tiba-tiba dalam like 6 bulan na tu Indah datang my period. So during that time, of course lah, as a teenager jua, you know, your body is growing, you know, hormonal changes and everything. So as the first daughter and also the only daughter in the family, so my parents couldn't understand what is going on. So my parents brought me to this clinic, and then the doctor gave me this one pill, which at that time I don't really understand what's going on. So I took that pill, and then within that 1 week I had my period. So I thought it was normal. Then for the past few years my period was irregular. And then asal saja macam, you know, Indah datang period atu dalam 2 ke 3 bulan apa, my mom would ask me and bug me macam, mana ada period muka? Macam I would say macam balum, because for me it's normal because I've experienced that when I was, you know, starting when I was 13. Kali macam she kept on letting me to pee on a stick because she thought I was pregnant. And I was like, no, you know, that causes some mental damage in you, you know, asal saja you're not getting your period, you're pregnant. I mean, it's kind of sad, you know. So macam I think paling batah I haven't gotten my period would be last year. It took me like 10 months to get my period. So I went to Dr. Prema Clinic actually. So I'm actually a patient there. So for that 10 months, for me, macam, okay, there must be something wrong, Banaya. You know, I know it's not because of my weight, because I've been trying to lose my weight for the past few years, but actually I've been gaining it more. And then, you know, it's kind of, how do you say, affecting you mentally. So I decided to go to the clinic to get a check. So at that time, I still don't understand what PCOS means. I mean, my doctor haven't really diagnosed me because aku kan patient baru. So they did give me ubat apa to try on for 3 months. So I did have my period for 3 months atu. But now I actually stopped my medicine. So I'm actually late. So it kind of worries me. Macam, do I really need that, you know, ubat apa to really get my period, you know? So I would like to ask Dr. Hajah Sohaila for this matter, like, you know, for people young encountering, for someone who, you know, haven't been diagnosed by haven't been diagnosed PCOS, but there might be a disorder on that one. So how do you really, you know, basically identify that the patient is actually, you know, having PCOS or PCOD? Dr. Sohaila, you are muted.
Can you hear me now?
Yes.
Yes. I heard Angie as well as Rina, her experiences and their experiences about loss of weight as well as yours. I will address your question as well, but I would like to share with you certain things that it's true. As soon as you are diagnosed with PCOS, or as soon as you go to seek medical help and somebody just tells it on your face that you need to lose weight, and that also within a very short time, it's very distressing and it doesn't work at all. That is not the way we believe. I mean, you know, it should be, I mean, spoken of. First of all, I want to give you also some information about the BMI issue. Even if you are overweight or you have a higher BMI, research has shown that you don't really have to go and achieve the near ideal weight according to your height and your ethnicity. A loss of 15% of weight on an average basis, or a loss of 15 to 20% of your own weight, whatever is your weight, will actually enhance and make the PCOS situation better, and we call it in medical terms, reduce your risk factors for having the symptoms which you have, irregular menses and acne on the face, and also as well as all the situations you go through having irregular menses. The other one I want to also point out that Angie said that back in 2008 and all those dates, it was very few. It was very few. We also in our practice did have PCOS situations where we knew this is PCOS, but we didn't have that much. But it is because we know how to diagnose it better today. And according to World Health Organization, statistics, about 134 million people a million women in 1 year can be diagnosed with PCOS. So that is to say that they have said in the diagnosis that it's quite a common situation you can come up with women nowadays. As a medical practitioner, we do come up. So they have actually diagnosed that it is a common endocrine and metabolic disorder in women. And of course, it is epigenetic. And as Dr. Sarina also said, that the genes are, but it affects us not with the DNA of the cell, it affects our cells. Another misconception is that the treatment modality which the doctor starts for you, of course, there should be adequate explanation before the doctor starts, is very disturbing to the patient, because one of them is a contraceptive pill, another one is a anti-diabetic medication. I mean, what is it? Do I have diabetes and do I have to practice contraception? I mean, what am I going through? So for these reasons, I personally, when I have to give them the combined pills, which is the combination, actually contraceptive pill means combined pills of both estrogen and progesterone, and they are in particular, combination. So that has been seen to be more effective in the treatment of menstrual irregularity. So the doctors, and from the medical point of view, would also like you to have regular menses, because it's very important. And within a year, as you have amenorrhea, means no menses for the whole year, that is not a good situation. That if you repeatedly keep on having it, it will end up giving you a dangerous situation, sorry to say, but it will get worse. So the menses which gynecologists should aim at for a woman, say she is very constantly amenorrheic, means having menses maybe 1 or 2 months and the rest of the year she doesn't have, or she may be having no menses. I have patients who have no menses, come and say I have no menses for 2 to 3 years. So you should give medication so that the woman actually has maybe 3 to 4 months of gap, but should menstruate within 3 to 4 months. Basically, there are different grades of the disorder, and you have to, sort of tailor make it for the patient's situation, the PCOS, because as I told you, it is a wide spectrum of symptoms, wide spectrum of health and mental issues. Then another one which I also want to say to Rina and Angie, and thank you very much for sharing your real emotional and what you had to go through. So this life-changing habits which you were properly counseled, this when you go to somebody and says, and their person says, oh, you're overweight, you just lose 10 kg in 3 to 4 months. That's absolutely not possible. Absolutely not possible. 15% of weight loss within a period of 4 to 6 months, if the person is, say, able to do it, the doctor should be applauding that patient, or the doctor should be happy, because this 15% of weight loss will lead her to a better situation, and then she can be inspired more and carry on with the lifestyle. It doesn't mean she has to become very thin like a model and be very perfect in her weight. No. You are you, what you are and how you look and what you are, it should please you and you are you. But because we have to change the insulin resistance factor, we have to download the androgenic hormones. a weight loss or improving the BMI, let's say improving the BMI, will help you along the way to deal with your symptoms. And of course, you will become inspired later that, oh, this lifestyle, I have changed from this to that, and it's helping me cope with the situation, both physically and mentally. And another issue also I want to mention about ovarian cysts, which I think Rina was diagnosed with. Cyst. You said you had a 3 centimeter cyst in your ovary.
Yeah.
That one, cyst in the ovaries, you will find in the literature when you go through PCOS that there are 2 types of cysts which the doctor should note. One cyst, which is polycystic, means the cysts are all, if the ultrasound is done, it's like a pearl, we call it string of pearls. It's like it's had given a very literary name, string of pearls, which means the ovary has cysts like a string of pearl all around, and it also increases in volume, but there are no big cysts. A big cyst, a solitary big cyst in any ovary implies some other problem. So in polycystic, which poly, the name itself says, you will have more cysts, but they will be a little bit bigger, but you will not have a solitary enlarged cyst. So these 2 things the doctors must know, how to distinguish when they do your investigations. And the last thing which I want to mention is polycystic ovarian syndrome and disease. Nowadays, you don't have to go through a battery of tests and things. It has become simplified. The diagnosis and the treatment, as I told you, there's not much choices. But most important thing is to be aware of it. Your family, when they take care of you, to get help in those proper times, adolescence and in the early reproductive phase, so that your journey becomes much better, so that you can enjoy your life. Also, when you want to get pregnant, you are in a much better position to try to get pregnant. And also when you are older, you can see in your family people who have become very old, but they were having PCOS before. They will enjoy better health because, as I will explain, I don't know if it's the proper time, the life problems which can happen to women with PCOS in older age.
Okay, so for Dr. Sarina, do you know if there's any support available, basically emotional guidance or group therapy that you know of that, can help a woman that, mengalami PCOS niya? Because some yang tidak aware yang dorang ada PCOS, but then having to be able to go through this dari awal, dari dorang umur teenager apa, belum lagi, ada that opportunity to go to, clinics apa. So what kind of, support available that you can give or, mention in this forum?
Alright, terima kasih Iziana, and also thank you for to Rina and also India for sharing your journey and your experiences. Right now, in relation to support group, okay, for PCOS and also trying to conceive, the support group ini in terms of yang trying to conceive sebenarnya banyak lah, especially di luar negara ada, and also there's a link banyak tu you can actually get from outside other country tapi di Brunei at the moment because ni jarang diperkatakan, okay, jarang kan di actually what do you call this, awareness satu kurang. Jadi platform ni yang what we're doing now is will help to actually increase the awareness of the public in relation to this, so that support will be should be available for this individual that require the support for advice and so on. Jadinya because ni ia jarang diperkatakan, and also the explore, because ianya satu masalah ni is very sensitive to share, and then some people they tend to be reserved about it. So and then because they of having the issues sana. So di sini ada beberapa recommendation lah untuk menolong wanita yang available lah, yang mengalami PCOS 1 in order to reach out for help. Currently di Ripas Hospital, Kementerian Kesihatan ia ada menyediakan perkhidmatan konseling di bahagian fertility clinic. Okay, for those yang women yang mengalami masalah kesihatan wanita, termasuk juga those yang having symptoms of PCOS. So bagi wanita yang mengalami PCOS ni, ia bolehlah membuat tabu janji tu jika ingin mendapatkan perkhidmatan konseling. Akan tetapi selalunya yang datang ke klinik ni orang yang sudah kan planning to actually have a baby but for the younger population, masih lagi teenagers selalunya dorang kalau ada masalah macam head dorang tu teratur, and then they feel that the symptoms tu affect them, like emotionally, and then they don't actually like the symptoms, how it actually did to dorang punya body, then baru tak dorang seek support. Baru tak dorang bertanyakan. Selalunya support ni it comes from the family. Okay, from the family member, and then kadang-kadang dorang bertanya arah kawan-kawan. Okay, so dia bertanya arah kawan-kawan, dan baru dorang sadar yang they really need help. Okay, so dari sana baru this individual ni teenagers ni merasakan yang PCOS ni is something that they need to actually address, in order for them to mengelakkan dari masalah yang lebih teruk lagi lah, ataupun yang boleh membuatkan dorang macam as Angie mentioned, you're becoming more like emotional about it, and then stress become stress, and also it can actually leads to depression kalau indah dorang meminta help. Okay, so support from family members and also friends, and then those yang actually pernah mengalami yang sama. Itu yang penting. Jadinya link yang support yang digunakan in terms of PCOS ni untuk yang teenagers yang belum lagi memikirkan untuk kan beranak lah, macam belum lagi yang menunjukkan into at that stage itu. So dorang bolehlah meminta pandangan lah. Okay, seek help from the hospital, the clinic. Okay, to actually reduce the symptoms, so that they are actually able to actually cope with it. Alright. Now in relation to support group of PCOS, okay, penting di sini in terms of mempromote kesihatan, okay, education and awareness on PCOS ni, especially among the teenagers and the women, and also the public, even husbandnya juga, okay, pun mesti juga tahu. Okay, ini penting bagi meningkatkan awareness satu, and then so that we can actually healthcare professional as a midwife or jururawat atau doktor boleh memberi nasihat dan rawatan yang boleh yang sesuai. Okay, yang di mana age macam is teenagers, kalau teenagers to actually reduce the symptoms, kalau if it's like kalau macam woman yang sudah berkahwin untuk yang mau anak, and then maybe the different approach of management and also care and treatment. So dari rawatan sesuai selalunya yang sesuai dibuat di peringkat awal lah, supaya dapat di-assess supaya apa treatment yang sesuai untuk mereka yang ada masalah ni. And then selalunya wanita ataupun teenagers yang mengalami masalah PCOS ni, dorang berjumpa setelah membuat, kadang-kadang dorang membuat rawatan sendiri Maksudnya di sini untuk mencuba dulu traditional approach. Okay, and then kalau indah sesuai baru dorang seek another advice ataupun healthcare professional. Ini disebabkan sesetengah wanita ataupun ataupun pasangan mereka sendirilah support itu kuat dari keluarga lah, dari keluarga, and then kadang-kadang dari kawan-kawan yang mengalami masalah yang sama. And then apa yang patut diambil dan dibuat untuk mengurangkan gejala ni. So advice itu macam untuk dari orang yang terdekat. Okay, support itu dari orang yang terdekat yang boleh menolong mereka either untuk mereduce the symptoms untuk teenagers ataupun for those yang sudah kahwin untuk meningkatkan kehamilan. Alright, macam mana? Ada satu kajian di Brunei, okay, yang dibuat among infertility individuals, okay, infertility couples, yang mana kajian tersebut membuktikannya kurangnya kesedaran tentang ketidaksuburanan ni. Diorang dah tahu, dah faham di kalangan masyarakat di Brunei. And then pengetahuan yang tidak mencukupi itu ditunjukkan melalui sikap negatif terhadap individu yang ada anak ni. Termasuk juga kadang-kadang support in terms of di workplace tu juga kurang kadang-kadang macam they feel that being tidak ada keadilan di sana juga katanya dari segi macam pembahagian kerja. Itu ada juga kau belum ada anak, then you can do more work compared to kami yang anak kami banyak dan banyak responsibility lagi. So itu another impact juga that actually affect those in the woman itu individual itu ada emotional ataupun stress. Okay, and then jadinya disarankan di sini pendidikan yang berkesan memainkan peranan penting. It can be done through roadshow, okay, and then from the forum yang tadi buat masa ni, okay, and then bukan saja untuk memberi pengetahuan tentang PCOS ni kepada orang ramai, tapi untuk meningkatkan kesedaran yang mana mereka boleh actually seek healthcare, okay, dari awal. Alright, dari sana diorang boleh tahu apa yang treatment ataupun management yang sesuai untuk mereka. Okay. Nah, pada masa ini juga pendidikan mengenai PCOS ni memberi juga pengetahuan kepada yang terjejas oleh PCOS tentang cara how to deal with emosi, tekanan psikologi ataupun psychosocial, di mana orang ramai especially close family members yang selalu kan bertanya bila tak akan ada anak lagi, lama sudah kahwin, belum lagi ada anak, So ini dimaklumkan tentang punca juga akibat boleh actually meninggikan lagi stress level among that individual tu. Jadinya payah tak lagi diorang kan fokus untuk kesihatan diorang sendiri. So itulah. And then support juga, kalau in terms of availability of support dicadangkan juga untuk actually menubuhkan PCOS support group. Okay, so support group ni can actually help those yang all the women at diorang punya childbearing age. Okay, so maksudnya termasuklah teenagers lah tu. So ini platform ni boleh pada masa ni di Brunei dah pulang ada ni. So barangkali it will be a good move, okay, to actually maybe develop ataupun menubuhkan support group ni. And then what I know in Malaysia ada satu support group for PCOS specifically, and then they name it My PCOS I Love You. Okay, so it's something that will encourage a woman ataupun individual to seek support from them. So it macam kira the word itself My PCOS I Love You tu ada caring di sana. Okay, so boleh improve ataupun invite more people to actually come forward, okay, to share their punya experience and how they manage their PCOS ni is very important. So now adanya platform ni So penghidap yang bukan saja mendapat maklumat diperlukan malah turut mempunyai kumpulan sokongan sokongan yang dapat membantu. Jadi we have a group of people who have a similar problem. As Angie said, it's not easy, for actually, people who don't actually go through dorang punya experience to memahami what they have actually gone through. So you need to have these people yang ada pengalaman, okay, untuk memahami the journey itu and how to actually help each other. Okay, sebelum in this way juga boleh juga dimasukkan in terms of healthcare professional in the group atau juga untuk actually menguatkan lagi pandangan mereka macam mana help atau can actually management atau is it actually relevant or reliable or not information yang disalurkan itulah yang di-share tu. So ini penting, okay. And then kumpulan ini juga boleh bertindak sebagai badan dan menjadi suara bagi mereka yang terjejas oleh isu PCOS yang boleh dibangunkan melalui media masa sosial. Okay, kebanyakannya orang akses semasa ni famous Instagram, and then Facebook, okay, Twitter, and also melalui blogging pun ada juga yang men-share dorang punya masalah di sana. So this can actually be as a platform to actually share experiences and how to overcome and manage the issues the problems. And then so dari sana juga berkongsi emosi dari sana, emotional management, self care management termasuk you di sini. How do you care yourself when you have the breakdown atau like if you have this emotion, if you feel that you need someone to actually talk to, this is the platform that you can actually let out, share your experience, how do you feel about it, so and then so ada rujukan juga yang boleh dipercayai yang boleh berminat ada link that you can actually access, okay, you can share this, okay, dalam group yang ditubuhkan itu. There is one link here in relation to infertility and also PCOS, menggunakan rujukan yang dipercayai seperti www.resolve.org. So this is one of the yang kena share among the women in my PCO I love you yang these are the reliable sources that you can get information in relation to PCOS and how do you get help, okay. And then another recommendation for support group is maybe perlaksanaan terapi counseling, active counseling, okay, bagi wanita yang trying to conceive ni. So ini harus disediakan dalam persekitaran yang selamat and then it depends on actually the culture and then the surrounding as well. Like di Brunei ni, our culture is is different from other countries kan, so maybe to say you have to be sensitive, so it depends on the individual culture and you have to respect juga, ada input of respect in there. So counseling bagi wanita yang trying to conceive, so termasuk dengan therapeutic communication. Okay, how do you communicate women with PCOS? You have to be sensitive. You have to, as a healthcare professional, we have to know this. We have to learn this. Okay, in order to actually, deal with women with emotional problem, depression related to PCOS. So how do you communicate, interact with them? Will actually help. Okay, them to actually overcome the emotions itu. Now, salah satu juga pendekatan yang paling berkesan untuk merawat simptom PCOS ni ialah as Rina mention tadi when you share about exercise, so ditunjukkan sebagai gaya hidup sehat. So and then makanan yang berkhasiat and then menjadi seaktif mungkin so mengekalkan berat badan yang sehat, tetapi as Rina and Angie said tadi share, so it's not easy to lose 10 kilo. Even myself pun kan to lose 1 kilo or 2 kilo pun payah, apalagi 10 so it's not easy. It's not easy as said and done. So maksudnya di sana it's actually don't stress yourself juga because of trying to actually lose that amount of weight. It's not easy. 1-2 years belum lagi kadang-kadang achieve that target. So enjoy the journey juga, and then make sure that you amalkan amalan sehat, and then and as well as like if you're unable to actually deal with the emotions and unable to actually cope with the apa namanya the feeling of the burden itu, let it out and share it with someone that actually you trust. Okay. Now another apa namanya ni, cara untuk menenangi masalah PCOS ni in terms of how to get actually appropriate support. I think the most important aspect of support here is your own close family members, your husband. Okay? So itu paling penting. Those yang sudah kahwin lah, mesti memahami, itu yang penting. Okay, husband and wife, ya suaminya mesti juga faham apa masalah isterinya. So kadang-kadang ada yang Indah dapat memahami itu terjadinya gangguan keharmonian rumah tangga. Okay, disebabkan ini. Dan campur tangan dari family lagi apa itu ini. Okay, ani mesti juga jalan. These are the things that orang community ataupun masyarakat mesti faham. Public needs to understand. So creating awareness of PCOS ni among the public, okay, is very crucial. It's very important. Alright. So I think yeah.
Thank you, Puan Doctor. So we have a few questions to the audience here. I'm not sure who can answer it lah. I'm wondering, has there been a success story among women who are experiencing PCOS in Brunei, succeeding in conceiving a baby after all support and treatments given them? So siapa yang adalah one of the panel speakers dapat menjawab soalan ini?
Right, Alhamdulillah, throughout my experience as a midwife, okay, and then also bringing student to the clinical placement, midwifery student, okay, we do actually, have experience receiving women yang berpuluh tahun baru ada beranak. So meaning to say, yes, there is a success story about this. So it's not actually it's not bukannya nada. So ada success story behind this juga. So they call it a precious baby. So macam dari sana we know. So when we look at the history, rupanya this is the issues because of having PCOS and so they're becoming more. When we actually look after this woman, dorang tu they're becoming more sensitive satu, and then they wanted to know more lagi. Macam susah hati, macam is my baby is going to be okay? Aku ni lama sudah baru first time ni, for many years, so 15 years cuma tu lah baru success. So so yes, ada success story. So never lose hope. Okay, never lose hope. Continue looking after yourself well. So itulah.
Okay, thank you so much for that, Puan Doctor. I understand that Dr. Haja Sohaila is wanting to share the story as well. Am I correct?
Yes, about successful pregnancies for women with PCOS, right?
Yes.
Yes, in my, say only about in Brunei, 24 years of experience in Brunei in Ministry of Health and in Ripas Hospital, we have many successful stories. And as I told you, the success is more likely to happen when the awareness and the help is sought earlier. And as I told you, for a woman after age 32, the fertility status declines, and after 37, it goes a real, like a steep decline. So when you know about your PCOS situation, or if you are now, getting aware that this is such a situation which may be associated with my irregular menses, if a person thinks like that and tries to get help. And as I told you, there are well-modulated investigations. It's not a very complex and very big list of investigation for a doctor to diagnose, but planned situations, including ultrasound. When she knows she has PCOS and she is getting married, there are people who are in, as I said, in adolescent period, early reproductive period, and they get help. They are more likely to have successful pregnancies. It's very, very much possible. I mean, there is no, turning away from the fact that we can always try and then see, we can always try. And there are success stories. Yes, there are. In Ripas itself or in Brunei itself. I think Dr. Sarina also knows very well.
Okay, thank you for that. We have another question for Dr. Suhaila. Before we proceed to another question, I'm aware that Angie has another meeting after this, so she has to leave. Sorry, Angie. Yeah, thank you so much for attending this forum, and thank you so much for sharing your stories. It's really a quite journey. So I think you can leave for your meeting now. Bye, Angie.
Thank you.
Bye.
Bye. Okay, continue. So the next question would be for Dr. Suhaila. The question says here, does it help if the cyst will be removed in order for the woman to get pregnant?
If
the cyst will be removed in order for the woman to get pregnant?
Not always. Not always. As I said, if you are in your young age, that is the reproductive period of life, and you have a cyst which is less than 5 centimeters, this is according to the RCOG and international guidelines, that if you have a cyst which is less than 5 centimeters, and this cyst can come and go for any woman, also for any age. But if there is a persisting cyst which is 5 centimeters, and if followed up within a period of 3 to 4 months of scanning, 4 months is a time which is also in the guideline, and it is increasing in size along with some other menstrual disturbances, or the ultrasound picture shows that the cyst is not a simple cyst, it has some findings inside, and the doctor then goes further to investigate it, and sometimes if it is a special tumorous matter like dermoid cyst or any other teratomy or anything, then that person has to undergo surgery in order to be treated. Otherwise, if the cyst is less than 5 centimeters and in a very woman of young age, we wait for it to even disappear on its own if there are no other physical symptoms. And women who are in the perimenopausal stage, I mean to say approaching menopause and menopause, and they are diagnosed with cyst, which is round about 5 centimeters or more. They say 4 centimeters nowadays and more. They deserve some more investigations in order to know that or exclude the bad thing, which is malignancy. That is for women in older age group, not for women who are in the reproductive phase, in the younger phase. You might have cysts coming and going, these are, and also the cyst is an incidental, mostly it is in the reproductive phase of life or in the younger age, it is an incidental finding by scan only. Sometimes you don't know you have a cyst also, unless you have a big cyst and very big cyst, or you slowly have developed symptoms. And they turn out to be some definite diagnostic tumorous masses. So those need treatment. We go by the symptom, by the size, by our ultrasonography findings, and also the follow-up and the group of patients you are seeing. The patient's age group is very important.
Okay, thank you so much, Dr. Suhaila. Actually, there's a question for Puan Rina. Any advice for fear of potential mother-in-law yang tidak dapat menerima menantu yang ada PCOS? The mother-in-law is particularly concerned when it comes to matters like that in general. So, do you have like an advice? seeing that you are trying to conceive Jua. So are you experiencing any,
I'm gonna say no to mother-in-law because my mother-in-law never does that. But I have experienced other relatives like cousins. Some of my friends also, they like jokingly ask, belum beranak ko, something like that. And to them it's like, haha, funny, but it kind of it's like a stab in the heart. So it's like that actually really hurts. And so I think advice for the women that receive those questions, honestly, is just need to macam bawa sabar saja. Like sometimes you cannot react. You just need to just take a deep breath, relax. Like maybe they ask from a good place. Maybe they just really want to know, like bila ta to tomato, but they don't actually know that the question is it's very personal to you. So for the people that do want to ask, I would just say maybe just be mindful and just be kind. When you ask certain questions to Mato, just be mindful. Like just imagine how they would feel receiving that question. So if you feel that they're gonna get hurt by it, maybe like word it differently, or maybe just don't ask at all. Maybe just to Mato last, because questions like that is very sensitive to people that are TTC, especially me. So that's all I would say about that.
Okay, thank you, Parina. And I understand, Joy, that you are selling nutritional supplements that helps for both men and women, to conceive and also for PCOS. And I understand that, Jua, from the audience, they've been asking, what kind of supplements that helps them. Check. So, can you share a brief story, about the supplements that you're selling? Because I know that a few of my friends bought supplements from you as well, and then it has helped them to get a regular period. So, mind sharing about that?
Okay. Yeah, sure, no problem. I only got into the business because I actually was a consumer of W Pro first. I bought from a seller here, but the product was not widely known. So when I consumed it, I wouldn't say it gave me my mens within like a month, but after 3 months of consistently consuming it, alhamdulillah, I actually got my mens naturally with off birth control pills. So from there, I thought, okay, this must be good. So I just kept consuming it, and then after about 6 months to a year, I stopped W Pro, but my period still kept coming. So that's when I thought, okay, I need to share this supplement with other people that I know go through the condition and that are trying to conceive Jua. And plus, they don't use any chemicals. It's pretty much ingredients that any traditional medicine would use as well. There's manjakani that use it in ubat untuk rahim Wanita and everything. So they use traditional ingredients, but they created it using modern technology, which I really, really like. So that's how I started the business.
I see. So, in Puan Dr. Haja Sohaila's opinion, for those who consume such supplements, does it help for because patients to have a regular periods, or it depends on the individual's body?
It is a little bit of an individual response, but yes, there are supplements which can actually reduce the intensity of PCOS. Like, for example, when we speak of lifestyle changes and the diet, which is very important, you can say that you can avoid processed food, you can balance your carb and protein diet, and you can eat iron-rich foods, but eat magnesium-rich food, cut down on caffeine, and then inositol. I'm wondering if Rina's supplement has any inositol in that, because we sometimes give inositol as not that treatment which we like to achieve with the medications, but as a supplement which will downgrade the androgenic hormone. So inositol is one of the things which is Federal Drug Administration has allowed doctors to use, because doctors cannot use many products in the market. And the research based on the production of these products is known probably to the people and the consumers, but it's not widely distributed for medical practice. So doctors usually are not very much in the way of adding supplements to all the treatments they give, but they do accept patients who are on supplements which sound healthy. And in case of PCOS, inositol is one of the things which I believe is present in many supplementary in medications, magnesium, zinc, and as doctors, we medically also prescribe inositol, which is allowed by the Federal Drug Administrations and for medical practitioners. But all the supplements which we speak about, medical practitioners are not aware of them, and they cannot really give you sound advice on which one is good and what you should use. But generally speaking, these are the things which you can get aware of in a PCOS situation.
Okay. So thank you for that, Dr. Haji Sahila. Soalan seterusnya untuk Puan Sarina. For people who have encountered macam irregular periods, yang belum tahu ada yang PCOS ni. So basically just a normal person who is encountering dia punya tanda-tanda lah sudah dikatakan. So certain families don't understand what they are going through, and then macam yang orang asal saja in the period itu pregnant dia. So and then macam I understand that people who encountered that feeling really stressful, and then that really caused you to not having your period more. So what kind of advice would you give to women, especially teenage girls yang encountering this?
Yes, thank you very much, Izana. So yes, selalunya masalah ni kalau teenagers lah, kalau dorang Indah tahu yang dorang tu ada mengalami PCOS ni and then they have this masalah head dorang dah teratur jadinya kadang-kadang kena label nya better ko check pregnant kali apa macam tu lah tu because at the current situation ni things can happen macam tu tapi itu if sekiranya teenagers itu tu awareness satu penting. Okay, they have to know apa reasonnya, apa actually the causes kenapa ia punya head tu indah teratur. Adakah satu because of kadang-kadang it's not because of PCOS kadang-kadang juga stress boleh je tu and then teenagers masa ni stress tu banyak faktornya. Kadang-kadang macam stress because of exam dia, like stress because of peer pressure. It can actually leads to juga head tu indah teratur and then hormonal imbalance. Okay, Dr. Sahila could be one of the reason juga. Okay, yang head tu indah teratur among teenagers because of satu disebabkan oleh obesity. Okay, boleh juga tu menyebabkan head tu indah teratur. Jadi you have to identify the causes first, the reason. Okay, if that you identify the factors, then baru you discuss you with your family barangkali these are the reason kenapa aku punya head indah teratur, barangkali I need to actually seek support from the medical professional. Okay, to actually explore further the true reason, the true causes of the menses dorang indah teratur tu. Okay, so dari sana like satu awareness mesti ada and then bukannya disebabkan oleh perceptionnya dah tentang head mesti ada something tu ada kali ni macam tu so itu indah it shouldn't be there in the first place. Kepahaman public and also among orang punya relative those your close friend juga relative, so awareness in relation to PCOS ni ataupun in relation to even bukannya PCOS penyebab head indah teratur tu boleh di share among the public as well. Bukan semestinya PCOS saja. Apa yang sebab-sebab penyebab head in the teratur-atur. That is for the teenagers. Kalau sekiranya untuk orang yang sudah kahwin, it's another different story. So if they have, if they want to actually try to conceive for many years sudah, and then they have been trying, using a traditional approach and all, and belum lagi success, I think it's best to actually consult the healthcare professional. Okay, di sini juga I would like to emphasize in relation to mengambil suplemen ni. And then also apart from suplemen yang kena luluskan oleh Kementerian Kesihatan, suplemen yang indah diluluskan yang banyak jamu-jamu yang berjual yang ada orangnya yang menses dimakannya ani and then ia menses. Tapi tadi anda tahu kandungannya, like herbal, so you need to actually before actually like mengambil herbal ni yang berjual di over the counter medication tu, so you have to minta nasihat juga dari Kementerian Kesihatan, adakah herbal tu selamat ataupun indah. Itu penting juga. And any other supplement, it needs to be actually approved by the Ministry of Health, okay, before you actually consume it. So kalau in the sure, kalau sekiranya ia kena jual online dia, and then ia in the sure niya, niya kena luluskan niya, boleh kau ambil, tapi ia in the sure, then you can actually contact the Ministry of Health to find out whether it is actually listed as a safe drugs or not. Okay.
Okay, thank you, Dr. Sarina. And before we end this forum, we have few questions to I understand that some of this question asking like during ovulation and also during periods, there is that cramp feeling arah your ovaries, especially like macam tajam lah rasanya. And then some may worry that it's something else, but some say, oh, it's just a good. So mind to share your side of understanding of why women experiencing such cramps and other feelings are punya ovaries during ovulation and also during periods. Dr. Saila?
Yeah, it's just that the ovulation period means your hormones have gone, the change in the hormonal status of the body, as well as during menses, all the hormones have come down to such a, so all these hormonal changes can cause the uterus, which bleeds during menses, the rahim, the uterus, they undergo some muscular contractions, which you feel as cramps. Some are very intense. Those are other situations which we doctors have to address and treat. But normally, woman may have some little bit of spotting in her mid-cycle, as called ovulation spotting. That time she may feel a little, as we know, temperature will be high, and sometimes she may feel a little bit bloated senses. Sometimes she may feel little unwell, and also some contractions, a bit of contraction in her uterus, the muscular contraction. Uterine muscle is quite different from our other body muscles. And also during menses. But when these cramps, that's why when these cramps are cramps which are generally speaking is okay, but it's because of the hormone change. But when these cramps give way to painful feelings and painful menses, and we call them dysmenorrhea, that is another entity altogether, and that person needs help from the medical side as well to diagnose why her menses are very painful. But cramps which a patient takes well and has been having all the time, menses are regular, menses are not disturbing, but she has cramps during menses, is all because of the hormonal change and the uterus undergoing, the muscle undergoing some contraction. So that can be taken as normal. But as soon as the person feels, no, I'm not feeling good about it, I'm feeling painful, it stops my functioning normally, that means she needs medical help regarding the pain.
Okay, understand. Thank you so much, doctor. So to summarize everything here, that having PCOS is actually can be can be recovered. And then, people, women need to be aware that, when you have the regular periods, do go to nearest clinics or hospitals to get a check, even though some doctors may not understand the situation, but do, see specialists, especially gynecologists. So, and also for those who is trying to conceive, from having PCOS, actually, there's basically there's a chance for you to get pregnant too. So don't really, be sad about it. Even though we don't really have, a support group in Brunei, but we can create one after this. So thank you for that, for Dr. Sarina for sharing earlier. So I'm really glad that everyone, be able to share during this forum, seeing that, you're not alone, encountering this, even though you're not having PCOS yet or being diagnosed, but if you have any of the symptoms, do please check. And if you feel that you're gaining weight because you're having irregular periods, do please check and go to the nearest clinics. I mean, I do that too, because I understand that sometimes people blaming, I'm having PCOS, so that's why I am having weight gain. I mean, actually, the stresses is doing it as well. So I'm glad that we are able to share this, and especially the support from all the audiences. And I'm sorry that we have to end this forum because we need to basically we have 2 hours only. So yeah, before we end this, I'm just gonna go around the table, from each panel of speakers, to say, kata-kata semangat apa to all the audiences, and also to the women who, who are currently diagnosed as PCOS and, basically trying to conceive. Do you have any, motivations to give? We start with Dr. Haja Saila.
Yes. First of all, as we started this program, and I know the main importance of this program will be to address that population who maybe, if not even diagnosed with PCOS, but young women and young girls, to be aware of the situation. That as soon as she has some menstrual disturbances, and she feels her body is gaining weight and other things, acne and other things which we discussed. So there is help around. And Dr. Sarina has got the guidance and the counseling set up also. But yes, first of all, in your heart, you must know there is help. And then there is plenty of things which you can do on your own, your change of lifestyle habits, which you can, get help from this your medical practitioner, your guidance, your even, I heard Reena get help from her physical instructor. So when you decide that these are the changes I have to go through in order to reduce the risk factors, because as I told you, PCOS is a lifetime situation. It can give other troubles to older women. So when you reduce your risk factors from the time you are going through that stage, so you must not lose hope. You must always understand that medical help is around. Also, it is a developing situation, like, because help is better now. It may not have been that much clear before to the medical practitioners or health caregivers, but now it is better. So I think this sort of forum through which you are informing the people should be hopeful. They should know that there is help around. They should also know that as early we start our lifetime, lifestyle changes, modalities, and gather more information from, about this disease, we will get along and have better life. And also the TTC situation, trying to conceive, you can, the doctor will feel very encouraged to help you to try to conceive, because you are, you know about your situation, you are doing so much. So that is helpful from both sides, I think. Yes. Yes. Thank you.
Sarina.
Okay, thank you very much, Dr. Celia. I do actually agree, totally agree with you 100%. Yeah. And then from my point of view, like it's very important to actually, to address the psychological, psychological and social impact of PCOS and TTS among the women. And ini yang penting, this is very important because support itu penting in order to help those individual women and also teenagers and even family members, termasuk juga bukannya women saja ni termasuk juga suami. Okay, durang pun mengalami juga ni apa namanya ni emotional impact of like their wife unable to actually conceive ni so it's actually an holistic approach, so meaning to say that if those yang ada masalah PCOS ni and teenagers yang also having head yang indah teratur seek support, okay, seek medical help and then don't actually like consume what you call this supplement that you don't know and also herbals that you actually are unsure of. So make sure you involve the healthcare professional in this although macam close family members ni kadang-kadang and also friends dorang punya advisor tu, especially those yang experience the same issues so it's actually good to listen and to actually share the problems, but if you unsure you can still go and seek support from the professional. Okay, and then what I can say here is like tidak ada penyakit yang tidak ada ubatnya and also tidak ada masalah yang tidak ada penyelesaiannya, so termasuk juga dengan rawatan dan also pencegah PCOS ini. Okay.
Okay, thank you so much, Dr. Sarina. Okay, next, Rina.
Words of advice for I'll just give advice maybe on the mental health of each and every woman that's actually going through PCOS and is also trying to conceive. So sometimes it will take over the day. You'll feel sad. It's just gonna make you feel all sorts of some sadness, like anger, maybe frustration, and all I have to say is just take a deep breath, just relax. Take it day by day. Don't rush to like conclusion. Like PCOS, there's no like quick recovery. It's gonna take a long time for the medical professions to help you understand it as much as you can, and for you to fully understand the effects of it to your body as well. So you need to just learn as much as you can. Never be afraid to ask questions. That's the one thing that I think a lot of the women yang ada PCOS and are TTC, sometimes they're a bit afraid or macam malu can ask questions. Don't be afraid. We're here. I'm here. You can always follow my personal IG. I'm happy to just answer questions. So just take it day by day. Just don't take it to heart. Like that's all I can say. Just take it day by day. Don't rush into everything. Just relax and seek help where it can be sought out to.
All right, thank you, Rina. Thank you for the wisdom word of wisdoms, and also thank you for this sharing session. Is really helpful to all, especially to those who are having PCOS and also who is trying to conceive. And then we are really glad that this session, really an eye opener for everyone. So I guess we can have our MC back to close the ceremony. Hello, MC. Kajap, oh, so sorry. No, not you.
Sorry. I wasn't able to unmute this now. But thank you so much to thank you so much to our moderator for facilitating such a wonderful event. I think a lot of people here in the audience can really feel macam mungkin pengalaman tu ada yang sama, ada yang berbeza, tapi I think generally everyone here is because everyone here is very, very concerned about their own individual health, walaupun we all here have different experiences, but I think the spirit and also of course the kemahuan untuk mencari information, kemahuan untuk mencari support, we all share that in another lah. So alhamdulillah kita ni sudah sampai ke pengakhir acara ini. Seterusnya ingin menjemput lagi sekali Haji Muhammad Ashraf bin Muhammad Ali daripada Jabatan Pembangunan Masyarakat untuk mengetahui bacaan surah Al-As. Silakan.
Bismillahirrahmanirrahim. Wal 'asr innal insana lafi khusr illal ladzina amanu wa 'amilus solihat wa tawasaw bil haqqi wa tawasaw bis sabr. Sadaqallahul azim.
Amin.